So the Mallampati score, it's a simple scoring system that compares the amount of mouth opening to the size of the tongue. And that provides us an estimate of the space available in the mouth for inserting our blade and inserting our tube. So one thing to know is that the Mallampati scoring system has a low positive predictive value in identifying patients at risk for a difficult intubation if used alone. So you can't really use the Mallampati scoring system to determine if a patient is at risk for a difficult airway if you use it alone. That is why we supplement it with other methods described in other videos or in another video to help us better predict a difficult intubation. Now let's get down to the scoring system. So Mallampati scoring system, goes from a class 1 to a class 4, and I touched on this in a brief video, or I touched on this briefly in another video, but how I like to teach the Mallampati classification system is if you look at the uvula, you can pretty much determine where you are in this scoring system. So there are other structures that we'll talk about, but the main factor is the uvula. So let's first start by talking about Mallampati 1. A Mallampati 1 is going to give us really good visualization of everything going on in the mouth. So we have our mouth here, this is our uvula. You are going to see our full uvula here. Uvula, you're going to see both our hard and soft palates. Hard, soft palates, and you are also going to see some tonsillar pillars. So that is our Mallampati 1. You have full visualization of the uvula. Our Mallampati 2, we're going to draw the same thing, our mouth opening. Our Mallampati 2 is you're still going to see the uvula, but you're just going to see not all of it, you're going to see part of it. The rest is going to be occupied or obstructed by the tongue. So you're going to see, let me just write here, in 1 you see full uvula, in 2 you see partial uvula. Here you're also able to see the hard and the soft palate. You won't really see the tonsillar pillars. Our Mallampati 3, is that you are not going to see the uvula because it is obstructed again by the tongue, but you will be able to still see the hard and soft palate. So here I'm going to say no uvula, but soft palate. That's Mallampati 3. And a Mallampati 4, is you pretty much do not see the uvula, just like in Mallampati 3. The tongue is in the way. And you don't even see the soft palate. So you can only see the hard palate. So here I'll write no uvula and hard palate. So you can see why I talked about why the uvula is so important. If you don't know all of the intricacies of seeing the hard palate, the soft palate, or the tonsillar pillars, the main thing is you're looking to identify, can you see the full uvula? If you can, you're a Mallampati 1. If you see a partial uvula, you're a Mallampati 2. If you don't see a uvula, now you've ventured your way into Mallampati 3 or 4. So if you don't see the uvula, but you still see the soft palate, you're Mallampati 3. If you do not see the uvula and you do not see the soft palate, all you see is the hard palate, you are a Mallampati 4.